The Tampa Cancer Center, Optimal Outcomes' latest cancer center development, was recently recognized at the 2013 Healthcare Design Conference for Excellence in Design and Construction. The Healthcare Design Conference is an international gathering of prominent healthcare architects, designers, administrators, facility managers, and other key members of the design community who meet to learn and discuss the newest trends in healthcare design, advancement, and technology.
We've got a lot of experience seeing different things over the course of time. And right now, this is a design-centered conference, but I think everybody would agree that healthcare is definitely going to go through some changes. There's going to be some trends, and one of them is there's going to be an increased emphasis on ambulatory care. The evidence-based design and the virtual healing concept is obviously important everywhere from our perspective, whether it's pediatrics, whether it is primary care, any of the specialties. But absolutely nowhere, in our opinion, is it more important than in a cancer environment. Nobody ever wants to go to a cancer treatment center, but if they do, we want them to come to ours. We want nice fields. We've got stonework for earth elements. We've got nice earth tones. Those are all fairly common that you start hearing about when you start talking about evidence-based design. We spent a tremendous amount of time with the staff to make sure that the flow within this facility works for the patient and the staff. And it's things like reducing extra encounters in a hallway. It's things like making it easy for wayfinding and signage and elements when you walk into a building for the patient who may not be feeling well to begin with, may not ambulate well, may be elderly. Where do they go to check in? That ought to be self-evident, and it is. The infusion area, where people come and they may sit there for 2, 3, 4 hours getting their infusion. There's things that may be simple, but they're worthwhile, like the Wi-Fi. There's television systems in there. There's access to research in there. There's comfortable seating that's grouped if you want to be with other people. There's also private rooms if you just don't feel like being with somebody. Again, options for the patients makes it helpful.
The Tampa Cancer Center was one of only 5 facilities selected for tours and was the only cancer center. Visitors to the facility included professionals from the U.S., Argentina, Brazil, China, Sweden, Denmark, Canada, Lebanon, and Qatar.
Florida Cancer Specialist is committed to providing world-class cancer care in community-based settings close to home.
It is mostly an outpatient care practice. That is to say, we treat approximately 98% of our patients in the outpatient setting rather than putting them in a hospital. So we think that this is a much safer environment in the outpatient setting, especially for the type of patients that we treat. We wanted to have what we call vertical integration. That is to say, a structure, a building that would allow us to practice in such a way that we could offer to our patients what I would call a one-stop shop.
The Tampa Cancer Center was developed for Florida Cancer Specialists and Research Institute, the nation's largest independent, privately held oncology hematology practice.